Hey, and welcome to The Explainer. We've all heard that a bowl of oatmeal is great for your heart. But what if the real secret isn't just the oatmeal itself? What if it's a specific, really powerful fiber hidden inside it, something called beta-glucan? Today, we are going to dig into the science and see if this is the actual key to lowering cholesterol.
So let's get right to it, right? Can that simple bowl of oatmeal you have for breakfast actually make a real, measurable dent in your bad cholesterol? I mean, that's a huge claim. So today, we're going to follow the scientific breadcrumbs and see where they lead.
Okay, so what in the world is beta-glucan? Well, it's a type of soluble fiber, which just means it dissolves in water. You find it in the cell walls of stuff like fungi and yeast, but, and this is super important for our story, you find it in grains. And it turns out oats and barley are absolutely loaded with it.
So, here's our game plan for this explainer. We're going to start with what I'm calling the 3-gram promise and the official weight behind it. Then, we'll get into the evidence, looking at the huge difference between studies in mice and studies in humans. After that, we're going to hit a major plot twist, the complication. And finally, we'll wrap it all up with your final takeaway on what this all really means for you.
All right, let's jump in with the 3-gram promise. And look, this isn't just some rumor from a health blog. The benefits of beta-glucan have gotten an official nod from some pretty serious people.
And when I say serious, I mean like the U.S. Food and Drug Administration. Yep, the FDA. They actually authorized a health claim way back connecting the beta-glucan you get from oats and barley with a lower risk of heart disease. That's a huge stamp of approval, basically saying, yeah, there's something real here.
Okay, so what's the magic number? Well, after tons of studies, the science has really honed in on this one specific figure. The consensus is that to get that cholesterol-lowering effect, you need to be aiming for about 3 grams a day.
But what does 3 grams even look like in real life? It's probably easier to get than you think. We're talking about 1.5 cups of cooked oatmeal, or 3 of those little instant packets. If you're into barley, about a cup of cooked pearl barley will get you there. It's totally doable.
And check this out. This quote is from a huge meta-analysis. That's a study of a bunch of other studies. And it just lays it out there, plain and simple. 3 grams a day of oat or barley beta-glucan is enough to lower blood cholesterol. In science, it doesn't get much clearer than that.
Okay, so we've got the promise. Now let's move on to the actual evidence. We're going to see how this whole idea was tested, starting with early animal studies and moving all the way up to major human trials.
Now, it's pretty standard in science to start with animal models. It's a way for researchers to figure out the basic mechanics of how something might work before they jump into really complex and expensive studies with people.
And right away, this early mouse study found something really interesting. When they gave mice beta-glucan from different places, the results were all over the map. The stuff from yeast, a strong, lasting effect. The one from mushrooms, it worked great at first, but then kind of tapered off. But then look at the grain extract. In the mice, it did almost nothing. This was a huge clue that where you get the beta-glucan from matters a lot.
So yeah, the animal studies were pretty intriguing, but honestly, also a little confusing. Which, of course, brings us to the only question that really matters. What happens in actual people?
And this is where the story gets really good, especially for oats. Let's look at a major human trial called the BELT study. They gave one group 3 grams of oat beta-glucan every day for 8 weeks, and the other group got a placebo. The results? They were incredible. A 15.1% drop in LDL, that's the bad cholesterol, for the group eating the oat fiber. And the other group? No change. That's a huge real-world impact.
So, case closed, right? Just eat your oats and you're golden. Well, not so fast. This brings us to the next chapter, the complication. It turns out not all beta-glucans are created equal, especially when you pull them out of the food they came in.
So while the proof for whole oats and barley is rock solid, a totally different story starts to unfold when we look at more recent studies on things like purified extracts and supplements.
This is where it gets wild. Look at this side by side. On the left, you've got whole grains, oats, barley, backed by tons of studies all confirming they lower LDL. But on the right, you have tablets and extracts. And a big 2023 trial found they had no effect. Another trial in 2021 on fungal extracts found the same thing, no benefit. So the big question is, why? And the key seems to be what scientists call the food matrix. Basically, the fiber needs to be part of the whole food to work its magic.
And just look at this chart from that 2023 trial. It's just wild. They gave people a placebo, a 3-gram tablet, or a huge 6-gram tablet. And check out the results. The 3-gram group's cholesterol actually went up a tiny bit, and the 6-gram group was basically no different from the placebo. This is screaming at us that something critical gets lost when you just extract the fiber and put it in a pill.
So what is that missing piece? Well, it seems to be all about physics, not just chemistry. And the secret word is viscosity. It's that thick, slimy, gel-like goo that the beta-glucan from whole oats forms in your gut. That gel seems to be the real hero of this story.
Okay, let's tie this all together. It's time for the final takeaway, where we focus on exactly how this whole thing works and what you really need to remember from all this.
So this viscosity thing is actually pretty cool and honestly kind of simple. Here's how it goes down. 1. You eat your whole grain oats or barley. 2. That fiber forms that thick gel in your gut. 3. The gel acts like a trap, grabbing onto these things called bile acids so your body can't reuse them. And that leads to the final step, number 4. Your liver needs to make more bile acids, and to do that, it literally has to pull cholesterol out of your blood. And just like that, your levels go down. It's a pretty brilliant system.
So, let's boil it all down. If you want to use beta-glucan to help with your cholesterol, here's what truly matters according to the science. The dose. You got to aim for at least 3 grams a day. The source. The best, most solid evidence is for good old oats and barley. The form. Whole foods just work better than the supplements studied here. And finally, the mechanism. It's all about that viscosity. That gel is non-negotiable.
And you might be thinking, why is a 10 or 15% drop in LDL such a big deal? Well, let's put it into perspective. Research has shown that for every 1% you drop your total cholesterol, you could reduce your risk of dying from heart disease by 2%. That means these small changes in your breakfast bowl can have a massive impact on the line.
Which leaves us with one final thought to chew on. When we're talking about our heart health, is the next big breakthrough really going to come from a lab-designed pill, or has the answer been sitting in our kitchen pantry all along?